How to get rid of stretch marks. Stretch marks can appear in men and women, young or old, and fat or thin. Stretch marks are formed when the connective tissue breaks apart while the skin produces an insufficient amount of collagen. Collagen is necessary to form the connective tissue of the skin. Stages: in the beginning stage, pinkish red marks will be appeared, that caused by micro blood vessels breaking up and bleeding. Secondly, change to pale silver white. After become bigger, they can cover the whole body. Causes: some stretch marks are still a mystery. It may be due to pregnancy, after gaining or losing too much weight. Some type of hormonal change may cause it. Lack of nutrients. Changes in environmental conditions. Steroids-related medications. How to prevent stretch marks. The best preventative measures include: make sure to drink plenty of water. Proper hydration keeps your body and your skin healthy. Eat a well-balanced diet. Perform light exercises while pregnant to maintain the skin's elasticity. Aerobic exercise can help tighten your skin up again. Exfoliate skin, avoid harsh chemicals, use sunscreen outdoors, moisturize skin treatment, 1 medication 2 National Home Remedies 3 Laser 1 medication. You can talk to a doctor or a dermatologist about them. There are some prescription topical treatments, not over-the-counter stretch mark remedies, that can help fade them. 2 natural home remedies. Take the necessary amount of vitamins. Home remedies include like wheat germ oil, aloe vera and cocoa butter, which will keep the skin soft. Other treatments include vitamin C, glycolic acid, and retinoid products. Avoid them while nursing. Coconut oil is a natural moisturizer. It contains properties that help to hydrate skin to nourish it. Apply coconut oil on target areas 2 to 3 times per day. Use coconut oil prophylactically during pregnancy because it's safe for both mother and baby. 3 Laser treatments can either be used to stimulate collagen production or to destroy the red color, leaving a less visible stretch mark. Follow us on social media